Hey guys, Jim King here. I'm going to be zipping through the disease chapters. Hopefully you guys will be able to see this on the day of the contest. Without further ado, let's just get right into it. Chapter 10. So chapter 10 is about childhood disorders, and it opens up with a talk of autism. And autism, as you guys know, is a really big issue for the people who have it. So the common symptoms you can see includes impaired social skills, verbal and nonverbal communication difficulties. However, obsessive interests. However, these are not the only symptoms. Autism can also have physical symptoms as well. You can have gastrointestinal problems, seizures. But despite all these symptoms, we have no real way to diagnose autism from autism right when a child is born, right? There's no single genetic or biochemical marker for autism, even though we found at least 100 genes that may be implicated to an increased risk for autism. And for this reason, we typically diagnose people with autism when they're about 3 years of age. However, if you're sensitive to social interactions that you see in a child, then you can actually detect the differences even when the child is like 1 or 2 years old. And that's a time when affected children actually you see a really abnormal accelerated growth of the brain, and actually that implies that the brain development has gone, something's wrong with it. And another interesting thing about autism is that that actually this could be due to a dysregulation of the immune system, and it could be from the mother or from the child, and so we don't really know. Yeah, there are still many things that we need to figure out about it. What we do know is that when you look at children with autism, you see that the brain alterations are subtle, and there aren't a lot of obvious changes compared to people with Down syndrome or people with Alzheimer's. But still, they obviously have a lot of impaired abilities, and obviously autism is a really big issue, and it's a good thing that science is continuously searching for more cures or answers to the problem of autism. So now let's move on to a talk of the next disease covered in Chapter 10, ADHD. So ADHD, or Attention Deficit Hyperactivity Disorder, is characterized by a lot of inattentive behaviors, hyperactive behaviors, impulsive behaviors. And most of the time, in about 60% of the children, they're going to continue exhibiting these symptoms as they grow older. And actually this can lead to a lot of problems, problems in school, in jobs, drug abuse, having relationships. All these things can be affected by ADHD. So when scientists look at ADHD patients, they found that patients with ADHD usually have a decreased amount of dopamine and norepinephrine in their frontal lobes. Actually, and this could be explain a lot about why we have the symptoms of ADHD. When we don't have the amount of dopamine and norepinephrine we need in the frontal lobes, the ability to concentrate is going to be impaired. Thus, we use stimulant drugs to treat ADHD. Methylphenidate, that's the example that they gave in the book. I know it seems counterintuitive, but yeah, stimulant drugs are used to treat patients with ADHD because they stimulate the increase they stimulate increased amounts of dopamine and norepinephrine in the frontal lobes and increase the ability to concentrate. They do have newer non-stimulant drugs, but for the purpose of our contest, you guys have to know that they use stimulant drugs such as methylphenidate to treat ADHD patients. Yeah, and so right now, similarly to autism, we have no objective diagnostic test. And actually, diagnosis now requires a comprehensive evaluation. You have to do interviews, parent-teacher ratings. Yeah, there's a lot of things going on at once. So again, ADHD, I think that science needs to continue looking into it. We need to continue doing more research on it to figure out more about why it's such a big problem, how it's such a big problem. Alright, so now the next disease I want to cover is Down syndrome. So Down syndrome is actually the most frequently occurring chromosomal condition. You guys know that it's trisomy 21, so you have an extra copy of chromosome 21 due to non-disjunction. So the main symptoms that you have with Down syndrome, you have mild to moderate intellectual disabilities, and then you'll have the physical symptoms as well. The low muscle tone, the upward slant to the eyes, the flat facial profile, the enlarged tongue. Um, the book goes on and on, increased risk of congenital heart defects, respiratory problems, digestive tract obstruction, right? And actually, this is really, really bad. By age 40, nearly all people with Down syndrome actually, they have a lot of neurological changes that actually are similar to Alzheimer's patients. And right now, what's even worse is that we have no cure for Down syndrome. So we still need to research more about Down syndrome and figure out what's happening on a neurological level. They do babies with what we do know is that babies with Down syndrome, they do develop much like typical children do, but they just develop a little bit slower, and we can help them a bit with interventional training. However, again, so we have no cure for Down syndrome right now, and we need to keep looking into it in order to figure out how to better help these individuals. So the last disease I want to talk about is dyslexia. So dyslexia is a reading disability, right? You have an unexpected difficulty in speaking or reading, and in people who otherwise would have the intelligence, motivation, and schooling necessary to read fluently and accurately. What's crucial to remember here is that dyslexic patients do not have some kind of intellectual impairment. Actually, a lot of them can be really, really smart. Actually, this is kind of a trend that you see in a lot of these disorders. For example, in autism, a lot of autistic patients are actually very, very much gifted, and some of the greatest minds in history may have been autistic, like Mozart, for example. He may have been autistic, but he's one of the greatest musicians of all time. So it's crucial to remember that just because you have a disorder like this, it doesn't mean that you're like intellectually inferior in some way, or that you can't achieve great things. No, these disorders they just impair you a little bit, but no, it definitely doesn't say anything about your intellectual potential. You can still be a really shining mind. So anyway, the same thing, that kind of theme, it goes with dyslexia, autism, yeah. And so right now I was talking about dyslexia. So as I was saying, dyslexia, even though people can be really smart, they have a difficulty with reading the words, and they have a lack of fluency in speech. They can hesitate before responding. They have some difficulty with word retrieval, and so they have a little bit they have a little bit of a struggle with language. So actually there are a lot of reasons why this could be on a neurological level. When we look at dyslexic patients, we actually see a lot of important neural systems at work. You have the parieto-temporal, occipital-temporal systems, and then you also have Broca's area. And we find that in these areas, for dyslexic patients, there could be like a functional inefficiency. So that could be part of the explanation that why dyslexic patients are dyslexic. So right now, what we do for dyslexic patients, we have interventional programs. We try to read more stories for them. We try to encourage them to use language more. So that's chapter 10. I hope you guys enjoyed that. Pretty soon I'm going to be moving on to the later chapters, 11, 12, 13, 14. Thanks, guys.